Hi everyone, my name is Dr. Richard Horowitz. It's a pleasure being with you today. I'm here to talk to you about a Omega workshop that we're going to be doing called Living Well with Lyme Disease, which will be at the Omega Institute on June 20th to 22nd, 2014. I will be there with Dr. Tom Franciscott, who's a naturopathic doctor, as well as Katina Makris, who wrote the book Out of the Woods. And we will be doing a workshop like nothing you've seen before for Lyme disease, where this will be more of a healing experience. We'll be teaching doctors and health professionals about all the new updated work on Lyme disease, but also this will be experiential for patients, that if you've suffered from Lyme and want to empower yourself with information and healing, this is what we're going to be focusing on for this weekend. I'm dealing with a lot of chronic disease in my office, and I think that the model, the Lyme MSIDS model, is applicable for many chronic diseases. As doctors, we learned in medical school something called Pasteur's postulate, that there's one cause for one disease. This is an old paradigm. The advantage of the 16-point MSIDS model that I've developed over 27 years of seeing 12,000 chronically ill people is that it takes into account simultaneous overlapping factors which cause you to be sick. So for example, if you suffered from fatigue, the reason your doctor and healthcare providers may not have been able to help you is it's not due to one cause. You may have multiple infections, immune problems, inflammation. You might have environmental toxins, detoxification problems with lack of adequate glutathione and antioxidants. Your hormones may be out of balance. You might have vitamin and mineral deficiencies, or you can't get to sleep, or the mitochondria, the part of your body that make energy, are all affected. All of these can have an effect on keeping you ill and affect the terrain of the body, contributing to persistent symptoms. And that's why people stay ill after just a 30-day course of antibiotics. We're going to discuss natural ways of supporting your body with this 16-point MSIDS map so you can help get back into balance. Now, what is the common denominator which underlies chronic fatigue syndrome and fibromyalgia and MS and many of these diseases we're talking about? Well, in fact, it's what I call the 3 I's. Chronic infections, inflammation, and immune dysfunction has an effect on people where it makes them sick. These infections create inflammation in the body and release inflammatory molecules called cytokines. These cytokines create inflammation, which creates oxidative stress, and it damages your body. And if you don't lower down these inflammatory cytokines by dealing with the infection and opening up the detox pathways, your fatigue, your headaches, your joint pain, your memory concentration problems, they're just not going to get better. We're going to show you how you evaluate all the sources of inflammation in the body that contribute not just to Lyme disease, but to most chronic disease that we're all exposed to at this point in time. Oxidative stress is the one major factor that is driving all chronic illness, whether you look at Alzheimer's disease, Parkinson's disease, cancer, heart attacks, rheumatoid arthritis, dermatitis, psoriasis, diabetes, cataracts, asthma, atherosclerotic heart disease. The one common denominator is inflammation. If you want to get off the Lyme hell ride and you want to have some fun and have a healing experience, I invite you then to spend time with us at Omega for Living Well with Lyme disease. Lyme disease and associated tick-borne infections are spreading worldwide in epidemic proportions. They're mimicking many chronic diseases that you've been diagnosed with or your friends and family have been diagnosed with. So come with an open mind and an open heart, and let's explore together how to live well with Lyme disease and find the spiritual messages in the illness that help move us forward on all of our healing journeys. Thank you for taking this time.